The patient fills in the form sends it over to the nurse. Now, the nurse has all the information organized and triaged by the AI. The AI says, well, this is a patient that passed out. This is triage, what we call here P1. This needs to be seen in the emergency department because we don't know what it is. Could have stroked out, could have been orthostatic hypotension, like a vasovagal episode. It could be something far more serious, right? It could have been an epileptic seizure. Who knows? So this is already arranged by Instant HPI for the actual nurse. And the nurse then even has a referral to the ED physician that she could send to the patient, explaining the entire process of all the information that was captured so that the physician doesn't have to do it again, or the nurse at the hospital do it again. This can all be done online. This would significantly decrease, because the other problems here in Quebec is, let's say the patients they don't have a family doctor, they get sick. They go to that nurse and then she goes like, well, I can have you seen tomorrow because this is different. You have like a dental infection. The AI says you could use Advil and have him seen by a dentist tomorrow, or he can be seen irreversible pulpitis, whatever diagnosis the AI thinks you have, dental cavities, dental fracture, who knows. The AI will prepare a document that can then be provided to the next person taking care of the patient in a streamlined fashion. So this, I recommend it to the government here to put it in the DSQ, which is the online medical record for all patients, so that it's accessible to doctors in the emergency department and the patient doesn't have to bring a paper that he printed. If it's done at the level of the Info Santé, it could be recorded directly in what already exists as a communication tool that's available to all physicians, nurses, and everyone else, including the patient. It would be even more transparent, very reliable. It's already perfectly secure. It's how the government communicates imaging results, lab results to patients, gives them their vaccination history and their medication list. This is how every person in Quebec has access to that. So this should be the new standard for consultation in Quebec. It's not to call 811. It's for all these people that don't have a family doctor. They should fill this form online, and this will streamline a lot of the work that's going to be done at that point by the AI. Is going to be available for all doctors, including the doctors that will ensure the follow-up after the patient has left the emergency department. How do you communicate that to people that have no clue what the hell I'm talking about? You're a doctor, you're hearing this, you're going like, it's impossible. And that's where we are. So this is my new challenge and my new fight. It's getting this to the people that are involved in making these decisions. Hopefully that we will ultimately get a more streamlined and efficient tool for the practice of medicine and providing care to the population here in Quebec. So operational efficiency, patient volume increase with same staffing levels of AI-enabled clinics. Let me explain this a little bit better. Increase with same staffing levels, operational efficiency. One of the statistics we had when we were actually analyzing, we were using Canadian Bureau of Labor statistics that there's already studies out there that say how much time a physician spends, like of every hour that he spends in patient care, like what percentage of that hour is spent in direct patient care, writing notes, writing prescriptions. This already exists for studies. So we took that information and then we multiplied it by the degrees of efficiency that we brought down some things. For example, it's very hard to tell people this is exactly how much it would help because there is tremendous amount of variability in healthcare from a patient to the next, unless you work in an extremely narrow service. So like we only do one thing. Like for example, in Quebec, we have something called winter clinics where they basically they see you for sinusitis, pharyngitis, all these upper URI type symptoms, bronchitis, all these things that happen typically in winter months, it gets worse. So the government created these clinics called winter clinics. If you have a winter clinic, it's easier to measure these things. But when you have a patient that comes in for depression, another one comes in for a follow-up of ADHD, another one comes in for a UTI, then another one comes in for a workers' comp. The time is very different from a case to the next. Different complexity requires more or less work. The patient volume, what is it referred to? So let's say you make, like I discussed earlier, if you work 8 hours a day, and what we have from some studies with AI scribes, I'm not talking about my technology. By the way, my technology is not even mine. It's put together by me, but it's using Llama. I use Llama, but I've used Opus, I've used ChatGPT, I've used DeepSeek, I've used pretty much every language model that I tried out there that you can have access to. These language models do the work. There's something doing the work for you behind all that. Now, the good thing is that some of these models are open source. So the government could extremely easily have an open source model and run the entire thing there and pay no AI fees to anybody. Do you understand how this is absolutely insane? A simple MacBook, this computer you see here, MacBook Pro that's maybe 3,000 Canadian dollars can do like 200 consultations an hour. 200 consultations an hour. The average physician is like struggling by having more than 6 patients an hour. This can do 200. So we can have like 6 doctors, 8 doctors, easy. Everything done for them through an AI. The AI is installed in the computer on a private server. So this is where we're going to, okay? Operational efficiency, definitely. So in a previous conversation I had today, or a presentation, I said that we had a study that said that the average time that a physician takes is 16 minutes for a note. It gets narrowed down to 3 minutes when you get an AI scribe. It was 13 minutes per case, 25 cases a day. We said it was about 70% of your time as a doctor is being instantaneously overnight solved and done for you instantaneously. This is not normal, like it's not the normal evolution of medicine. I earlier spoke about buying a stethoscope from EcoHealth that costs $500. It's a simple evolution. We're talking about operational evolution. This 17% patient volume is a fallacy. It's not accurate. So we have multiple studies saying all these things. The truth is that it's not even reasonably quantifiable. It's not reasonably quantifiable. But what will reflect is your practice. When you start using these technologies and you see how your practice is like significantly better, you're going to see what I mean. It's the way to go into the future. Combined impact across healthcare, revenue optimization, improved ROI, enhanced productivity. It's all the same. It does the work for you. AI does your work for you. What can you trust it with is the first question. What can you do for me that's reliable? So this is where you either see it, you have to see a demo, or you look at technologies yourself and you can build it yourself through things like MyGPTs, which is another method that you could use. You combine different tools. You should see my video on the different tiers of automation for medical practice. So you understand you bring different tiers of AI automation together, different tiers of automation of which AI is a tool within the different tools. You bring them together and then you have pretty much 90% of your work done for you. That's how it works. Key takeaways, immediate ROI. This is one of the most impressive things. When you're a builder like me, programmer, physician, AI enthusiast, and you start working with these technologies, you hit these walls that you could spend 10 hours trying to fix. When you fix that problem, it's like night and day.